I've been receiving a lot of questions about ACL rehabilitation lately, and it's become clear that many of you have similar concerns. So let's dive into the top 4 most frequently asked questions about ACL surgery and recovery. The last one may surprise you. Will I be able to return to sports after ACL surgery? And if so, how long will it take? ACL reconstruction surgery is a lengthy journey from surgery to returning to the field, but many athletes can do it. But first, you must regain your flexibility, knee control, strength, and power in your legs to be able to tolerate the conditions of sport. But that's only half the story, because many of you will notice you are feeling pretty good after the first couple of months. However, a critical piece to understand is that it's not just about the physical performance. It also has to deal with the healing timeline of the newly reconstructed ACL. Research suggests that it takes about 9 months for the newly constructed ACL to reach sufficient strength to tolerate the demands of high-intensity athletics, with those returning to sport before this point having a much higher risk of re-rupture. So just be patient and focus on rehab. Get as strong and as powerful as you can during the first 9 months after surgery. What exercises are safe to do after ACL surgery, and when can I start physical therapy? Well, you can start physical therapy pretty much right away, but during the first 3 to 4 months, ACL rehab is pretty similar across the board. This is because the rehab process follows a phasic approach, where specific goals should be achieved prior to advancing to the next phase of rehab. These are both time-dependent, but also criteria-dependent, meaning that you should hit specific milestones before advancing. There are situations where people would advance to the next phase when they are not ready to do so because they did not hit the established milestones, and they run the risk of setbacks due to injury, or simply they plateau and are unable to progress because their body simply doesn't have the capacity to perform the exercise in the next phase. Generally, the initial 0 to 4 weeks is dedicated towards swelling and pain management, regaining full knee mobility, and restoring control of your quadriceps muscle. This is achieved through gentle knee range of motion exercises, simple balance exercises, and motor control exercises such as leg lifts. Once sufficient knee mobility and quadriceps control has been restored, the focus transitions to increasing stability and strength in the legs through more challenging single-leg balance activities, body weight exercises such as squats and lunges, as well as introduction of machines, including leg press, knee extension, and knee flexion machines. The focus in this phase is on progressive strengthening of the operative leg, while also making sure to effectively manage pain and swelling. Typically after week 12 or 3 months after surgery, you should now have sufficient strength and knee control to allow for more impactful activities. During this phase, you'll begin running and jumping progressions, focusing on landing mechanics and building up your ability to develop power and accept the forces of impact. Simple agility drills will also be introduced to improve foot speed. Once you demonstrate the ability to accept impactful forces through the knee without increased pain or swelling, while also maintaining good knee control, you are ready for the final phase, which typically begins around 6 months. This is the controlled return to sport phase of rehab, which heavily focuses on sport-specific drills, simulating the movements and environments of the sport you are looking to get back to. And hopefully by that 9-month mark, you'll be ready to go. What are the potential complications or risks associated with ACL reconstruction surgery? While ACL reconstruction can be highly successful in restoring function and allowing people to return to their pre-injury level of activity, it is not without its risks and potential complications. Some of the most common complications with ACL surgery include infection, persistent knee stiffness, anterior knee pain, and re-tearing. Infection at the surgical site or within the knee joint is rare, but a serious complication of ACL reconstruction surgery. It can manifest as redness, swelling, warmth, and increased pain around the incision site. In severe cases, infection can lead to joint damage and compromise the success of the surgery. To minimize the risk of infection, surgeons adhere to strict sterile techniques during the procedure, and patients receive prophylactic antibiotics before and after surgery. If you develop a fever, or if you start to notice an increased level of pain and swelling that is unrelated to activity, make sure to let your therapist or surgeon know. Following ACL reconstruction surgery, some patients may experience knee stiffness, known as arthrofibrosis. This complication can occur due to excessive scar tissue formation or inadequate rehabilitation. Stiffness in the knee can significantly limit range of motion and movement. Another common cause of stiffness is something called a cyclops lesion. We did an entire video on this condition, which you can find in the description below if you're interested. Development of these issues can be avoided with early range of motion exercises, but sometimes it's unavoidable. Another complication is due to aggressive rehabilitation protocols, particularly those that involve rapid progression of exercises or exercises that excessively load the knee joint too early in the phases of rehab. This can increase the risk of developing tendonitis or other overuse injuries, which can delay the recovery process. One of the most significant risks associated with ACL reconstruction surgery is the potential for re-tears or graft failure, especially in those who return to sports or high-impact activities too soon. Rushing back to sports before the knee has fully healed and regained strength and stability can increase the risk of re-injury to the reconstructed ACL or other structures in the knee joint. That's why it's so important for those recovering from ACL reconstruction to be patient and adhere to the rehabilitation protocol. Gradually reintegrate sports activities under the guidance of a physical therapist once sufficient control, strength, power, and performance has been achieved. Before we get into the last question, if you're liking this video, don't forget to hit that like button and consider subscribing to the channel. Your support goes a long way in helping us grow and continue to provide you with the answers you need about your rehab and recovery. Do I need to get an ACL reconstruction? It may come as a surprise given the prevalence of ACL surgeries, but the truth is you don't necessarily need an ACL to function effectively, especially if you have regained excellent knee control and stability. However, this scenario assumes that you're not experiencing instances where your knee feels unstable or is prone to shifting out of place. If your lifestyle doesn't involve high-impact sports that demand sudden changes in direction or force through the knee, you can often manage without an ACL for basic daily activities and even some light recreational sports. This situation is contingent upon your dedication to rehab and achieving robust strength and control of the knee. So whether you need an ACL reconstruction depends on the individual circumstances, activity level, and goals. While ACL surgery is often recommended for individuals engaged in high-level sports or experiencing significant instability, it's not an absolute necessity for everyone. Your orthopedic surgeon or physical therapist can provide personalized guidance based on your specific situation, helping you make an informed decision about the best course of action. Well, there you have it, 4 of the most common questions I get when it comes to ACL surgeries. Don't forget to hit that like button and subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.